So delirium comes in many different forms. There is hypoactive delirium, where you have your patients are mainly very sedative, sleeping, not really wanting to do much. And then you have your hyperactive delirium, where your patients are running out of the bed, pulling at lines, kind of being a little more aggressive. And we need to be able to help pull our patients out of that delirium. So some of the things that we can do as a nurse is we keep blinds open. We try to help reorient the patient. We make sure that they have their assistive devices, such as glasses, hearing aids, anything that they use. We also will have the TV on, try to get the patients out of their beds, up in the chairs, moving around. We do ask that other ancillary staff can help as well. Just talking to them, asking them how their day is. If you see them watching TV, you could bring up things like that. And then we also ask the families, if there's families around, we ask the families to also do these things as well. Encouraging the windows open or blinds open. A lot of families sometimes would like to shut it as the patient's request, but we do like the blinds to stay open. It does help to pull that patient out of delirium. When our patients have delirium, it can alter the way that we care for the patient. They can either injure themselves, they can injure staff, they can injure families because they're not in their right mind, so they really don't understand what they're doing.
Hi, I'm Robbie, and I'm a family member of a patient that was in the hospital for over 100 days after some cancer surgery. He experienced delirium 3 times over the course of that 100 days. The first one was right after the surgery, and the nurse, after we'd been in ICU for about 2.5 weeks, said, "I think your husband's getting delirium," when I got ready to walk in the room. And I didn't really know what he was talking about, because to me it just seemed like he had depression. He didn't want to talk, he was just real quiet. So my oldest daughter, she can kind of coax her dad on more than I can sometimes. She came in and gave him a good talking to, and said, "You've recuperated. The surgery, yes, we've had a hiccup in the plan, but it's gone. We need to move forward." And he came out of it pretty good. And the doctor wanted him up and out and moving, so we moved up to the surgery floor. And then at that point on the surgery floor, he began to have some pain, and we had to go back into surgery. At that time, they put him on a respirator for 5 days. And the nurses told me when I would go in each day when he was on the respirator that for me not to be alarmed, that when he came off, he could have delirium. And I'm thinking he's going to be kind of crazy. And what ended up happening was that 5th day when I entered the room, he was laying in the bed, and it was very scary because he looked like he was comatose, but he was staring just straight ahead. His eyes were blank. He didn't speak. He didn't respond to me. I said, "Ronnie," he wouldn't squeeze the doctor's hand. He was just somewhere else. And they did some further testing just to make sure there wasn't a stroke or anything else, and they said no, that wasn't it. And that's when they started telling us, the neurologist said, "You need to open the blinds," and they are not going to like you to do that sometimes early in the morning, but open those blinds, turn the lights on, have the TV on during the day when he's there. They put him back up onto the surgery floor. The poor surgery nurses, they did a fantastic job. They're wonderful. And they, kept working with him, and then we went to rehab. We did get in rehab, and it was at that point that he began to get progressively better, because he was getting up and he began to move around and walk, and at that point he began to sleep all night because they moved him all day, and that's when he really got better. And I really appreciate everything the hospital did for him.
One of the things that family members can do to help prevent delirium or to bring a patient out of delirium is to keep talking about their life. Bring in things that they are used to. You can talk about family, foods, shows, radio, anything like that that the patient really likes to do. If they are a knitter or if they like to play games, cards, you can bring those things in so that we can keep the patient oriented. Being aware of delirium is the best prevention. Notify your nurse, your aide, anybody in the room that your family member this is not them, that they're not acting right, because this can help us to see the signs and to stop the delirium from happening. All these interventions may sound like a lot, but in the end, they do help to prevent the delirium.